Hello everyone, my name is Morgan. I completed my community health assessment project within the community I currently live in, which is the city of Wauwatosa, Wisconsin. In Milwaukee County, it is about 7 miles west of the city of Milwaukee. It is approximately 13.2 square miles and holds a population of 47,000 people. Wauwatosa is a highly active community that is home to many, and the average age being 38.7 years old, and 17.8% of its population is age 65 and above. The city of Wauwatosa has a large education system, great transportation system, and good access to healthcare. But one of the most prominent social determinants of health that greatly affects the community is the housing market. There aren't many homes on the market or vacant apartment spaces available, which makes for a tight housing market, as the demand greatly exceeds the supply. But something the city is working on right now to address this issue is offering help to homeowners build accessory dwelling units on their properties. These are small homes or backyard apartments that can be built on residential properties. The city is offering $25,000 in building assistance. Not only do these ADUs add to the housing market and aid in Wauwatosa's deficiency in homes, but they also offer new residents affordable housing and provide homeowners an opportunity to generate income from these rentable units. Wauwatosa is a lively suburban area that is primarily of residential use, which gives it a small town feel. The area offers endless social and leisure activities through its diverse environment filled with various local businesses, restaurants, cafes, pubs, nature areas, bike paths, and walking trails. It is highly populated during the summer months due to the abundance of community events, athletic tournaments, and concerts offered. The community provides the perfect balance of city and suburban lifestyles, which makes it a great place for families. The city has numerous modern apartment buildings and a heavier mix of older style family homes. Just about everything you can think of is within walking distance, including grocery stores, convenience stores, restaurants, churches, pharmacies, libraries, and schools. The city provides an excellent transportation system for all. This includes sidewalks, bike trails, access to electronic bikes and scooters, public buses, and metro trains, all of which makes for a safe and efficient travel. The safe environment that Wauwatosa provides allows for locals and children to play and walk around town at leisure. The city encompasses a large school district with older buildings and updated playgrounds, sports fields, and indoor complexes. Wauwatosa is less than a 15-minute drive from various colleges, including Wisconsin Lutheran College, Marquette University, the University of Milwaukee, and Milwaukee Area Technical College, all of which makes Wauwatosa a popular area for young adults. That said, many of the homes and apartments that are rented in this area are rented by medical students. Wauwatosa is home to two major hospitals, Children's Wisconsin Hospital and Froedtert and the Medical College of Wisconsin, which is where many community members find employment opportunities at. Milwaukee County is the largest county in Wisconsin, and the city of Wauwatosa constitutes just about 5% of the county's population. The demographic breakdown includes 79.9% white, 7.2% Black, 5.2% Hispanic or Latino, and 4% Asian residents. The median household income is $93,000, which is significantly higher than the state and national average. The city has a poverty rate of 5.9%, which is significantly lower than the state and national average. But they also have a 7.5% of the city still relying on Medicaid. The businesses that have the highest number of employees is the Milwaukee Regional Medical Center, which consists of the Medical College of Wisconsin, Froedtert Hospital, and Children's Wisconsin Hospital. The leading causes of mortality and morbidity within the community are the same as the state and national level, which are heart disease, cancer, and unintentional injuries, which brings me to how I became interested in my topic. Since I started working at Froedtert Hospital located in Wauwatosa, I've seen so many elderly patients admitted because of falls, in addition to many of them having longer hospital stays related to a cascade of other health problems that stemmed from the fall. Falls are preventable, and yet the leading cause of death and injury in older adults is falls. Through this discovery, I felt that this was a major community health need that required attention. An appropriate community nursing diagnosis is the risk for falls among older adults aged 65 and above related to a knowledge deficit in fall prevention interventions and their associated risk factors. Through my research, I learned that Wisconsin is actually the state with the highest rate of deadly falls in the U.S. Most falls occur inside the home, such as the bathroom, bedroom, and stairways, and in 2022, falls made up 18% of emergency service calls. My project focuses on educating the participants about falls and risk factors, what to do if a fall occurs, and an emphasis on fall prevention through healthy lifestyle modifications and exercise. My short-term goals were, after my educational presentation, the seniors will be able to verbalize what risk factors are for falls and which risk factors influence them individually. My other short-term goal was, after my educational presentation, the seniors will be able to demonstrate what a safe environment looks like that is free from potential trip hazards. And for my long-term goal, 6 months after the educational session, the senior community staff will note an increase in physical activity participation and a decrease in falls by less than 2 per month. I formed a partnership with the St. Camillus Jesuit Retirement Community located in Wauwatosa. They are a nonprofit retirement community that provides a range of services and a welcoming environment for senior independent living. The community consisted of retired priests with an age range from 76 to 96 years old. I got to know my liaison, who was Father Sean. He is the minister there and takes care of all religious needs, works on the community budget, and manages housekeeping services, maintenance needs. He assists in transportation, healthcare, and dietary needs, as well as taking care of daily supply orders. With the help of Father Sean and our shared goal of preventing falls and improving health outcomes within our community, I created an educational presentation for the Jesuit community and found some community resources they could benefit from. Starting with the Milwaukee County Falls Prevention Coalition, they are an interprofessional group that advocates for the aged population and collaborates with others who share the same goal of preventing falls. The Milwaukee County Falls Prevention Coalition helps provide access to community education and exercise programs, interventions, and additional resources that older adults can utilize and benefit from, such as affordable home repairs and renovations. The Jesuit community can benefit from partnering with them by coordinating staff training and volunteers to assist in home modifications, provide health education, reinforce education on fall prevention interventions, and exercise workshops that target strength and balance. Another resource is the Wisconsin Institute for Healthy Aging. They're an organization that offers numerous evidence-based programs and services to older adults. These programs encourage self-care and independent living and promote healthy lifestyles and slowed progression of illnesses within communities. They offer many educational opportunities for healthy living, chronic disease management, brain health, fall prevention, nutrition, mental health, and various physical activity programs. The Jesuit community would benefit from this partnership with all the resources, education, and health promotion strategies that they would provide to improve the health, physical mobility, and to prevent falls and improve the quality of life of those in the older adult population. To implement this project with the help of my liaison, I was able to present to 11 seniors that live independently within the Jesuit community. I created a presentation and brochure on Canva with the following information. I covered the effects of aging and how these declines are associated with an increased risk for falls. I discussed risk factors, the development of a fear of falling, and the importance of knowing the risk factors. I also provided visuals and steps that address what to do if a fall occurs and how to get up on their own if they're able to, as well as steps on what to do if they were unable to get up and how to call for help with and without emergency devices near them. I also covered how falls can be detrimental to their health, covered the most common places for falls, and went into depth about how to prevent falls by eliminating trip hazards and adding proper home modifications such as grab bars and improving lighting. I educated the seniors on the importance of foot health and adequate footwear, nutrition, polypharmacy, and potential side effects of certain medications. Lastly, I heavily educated the seniors about the importance of exercise as the best fall prevention strategy. I addressed the benefits of physical activity, provided statistics, and discussed various ways they can get active in their community. To assess the knowledge and understanding of my older adult audience, I created an interactive activity for them to complete before and after my presentation. It asked the seniors to find and circle fall risks on a printed image of a home filled with trip hazards. My liaison thought my implementation ideas were great and had only suggested not to put anyone on the spot during my interactive activity, which I respected. The primary goal of this project is to educate the older adult population about falls and to raise awareness about early interventions and fall prevention strategies. To promote overall health after my presentation, the seniors were able to verbalize individual risk factors that increase their risk for falls. They also demonstrated what a safe environment looks like that is free from potential trip hazards through my interactive activity. I also reached out to my liaison 1 week after my presentation to see if he had noticed any behavior changes within the community, like tidying up their spaces or exercising more. He said participation in physical activity was about the same, but he did notice someone who was not in my presentation cleaning out their space. So he and I both hoped that someone who was at my presentation told them all about it. In conclusion, throughout my community project, I was able to take a deep dive into the community in which I live. I learned the heavy strengths and weaknesses of the community and its resources. Partnering with St. Camilla's Jesuit community gave me invaluable experience with the community. My community project successfully achieved its goals of educating the older adult population about fall risks and raising awareness about fall prevention to promote positive health outcomes.